Hello, everyone. This is Moal Sumidai, and I'm the chief editor here at the Clinical Trial Vanguard. And I'm here with Matt DeFranco, who's the senior director of disclosure strategy at Veeva. And we're here at the Veeva R&D and Quality Summit in Madrid. Welcome.
Thanks for having me.
Yeah,
Yeah.
it's such a pleasure.
Yeah.
So we've got a few questions for you here
Sure.
around the EU CTR.
Okay.
Can you tell me what specific pain points does EU CTR introduce for sponsors in terms of like disclosure management?
Sure. So I think the biggest thing is just the amount of complexity. So between the data you need to prepare, the documents, you need to redact documents. There's very tight timelines and response timelines to do that. So that's a huge pain point there. And then just not having, alignment, across your organization, to handle that, all the different departments that are involved and functional areas that are involved. So it's really challenging to get that all together. And I really think people underestimate that when they get into it.
Mm-hmm. Mm-hmm. And can you describe a bit more around some of those challenges? Is it because of disparate systems? Is it because of lack of integration?
Yeah, so I think a lot of times, people think of EU CTR just as a regulatory submission, but in actuality, it really touches clinical operations, regulatory affairs, legal needs to get involved. So when you really look across that, everyone needs to be in sync to understand what's going on. And if you don't have a central area where you can gather data and documents and keep everybody on track, it's very challenging to pull this all off in the timelines. And again, at the end of the day, all these submissions are going to be made public on the CTIS or Clinical Trial Information System, registry. So making sure there's no errors, putting something out there in the public, there could be a lot of scrutiny. Mm-hmm. So really need to be connected and have a unified process for how you do this.
Especially when you're doing it at scale.
Absolutely. So as you can see, sponsors of all sizes have a lot of trials, going on simultaneously. So you can imagine, the volumes of work that go into that.
Mm-hmm, mm-hmm. And so what kinds of approach or technology are you using to centralize and streamline some of that compliance?
Sure. So we're taking a centralized approach. So we have an application called Veeva Disclosures that recently launched. And what that does is it really simplifies and standardizes the process. So the fact that it's unified on the clinical, platform, it's going to allow you to easily tap into study data, documents, and then we'll be able to, automate that process, give you that workflow management, that centralized oversight. So you have everything in one place and know exactly what's going on and what your timelines are.
Mm-hmm. And what role does automation and integration with CTMS and eTMF play in simplifying this work?
I mean, with Veeva Disclosures, it's really a game changer. Again, because it's unified on that clinical platform, what we're able to do is seamlessly integrate with your study data and documents. So you're not going to have any third-party systems. It's going to reduce your need for, manual processes like spreadsheets and other trackers. And then this way, we're really going to be able to apply some great functionality, rules, automation, workflow, so you know exactly what you have to do and when. And all your information and documents are going to be in one place. Mm-hmm. So it's really going to be a more efficient process.
So really, you have your documents in one central repository, like your eTMF,
exactly,
your CTMS databases, and then this integration into EU CTR takes specific documents and then lists them and submits them to the EU CTR.
Yeah, so it's pretty much like that. So you need to gather documents. There's also data involved as well. And then again, a lot of times you have to redact, documents because you don't want to put company confidential information out there, personally identifiable information out there. So once you do that and gather that, that submission gets packaged up and gets loaded to
Mhm.
the registry, the clinical trial information system.
And are there approval systems in place to make sure that, like, let's say I'm a regulatory person, I have to review the documents before they go submitted, rather than, a CTA, like our trial associate uploading something into the database, it might be the wrong document, right?
Exactly. Because we're using TMF, we can leverage what are called expected document lists in Veeva. So you're going to know specifically um, what state that document's in. Is it in review? Has it been approved? So you're going to have that most recent version, the one that's
Mhm.
publishing ready to be able to go after it. And you can
Mhm.
easily collect them. We can create those lists so you know exactly what you need for each part of that submission.
And it's great that, you have all of your quality in one place, essentially. So there's consistency in submissions. It's not like there's a disconnect, like there's a new version that wasn't submitted, for example, or, there's an outdated version. Could you tell me a bit about that? Like, let's say you've got an outdated version of a specific document. Walk me through what it would be like for a trial associate, for example, to upload the document. Are there notification systems in place?
Yes. So, on the document level, yes. So there's different, states, life cycle states of that document. So, and then of course, with the rules that you can use in the Vault platform, you can put certain validation around that. So, and workflow around that. So again, something must be approved in order to go to the next step. You can build some of those QC checks into the process. So you're not going to have any of those mix-ups where something went out that wasn't really ready to go. So you're going to
Hmm.
have that complete oversight and visibility, and then it's really going to minimize and eliminate any mistakes like that can
Hmm.
happen.
Hmm. And can you walk me through how your team approaches disclosures management in a real world study workflow, for example?
Sure. So again, because things are seamlessly integrated with our CTMS and ETMF, let's say a new study gets created in CTMS, that's going to need to be disclosed. So what's going to happen is once that study is created, it's automatically going to show up in Veeva disclosures, and with it is going to be all the pertinent study information that's needed for disclosure. So that's going to be your milestones, your study start dates, your site information. Then you'll be able to also get your documents. So you'll have all that together in one spot, and then that's where we'll be able to apply rules that'll tell you when is this submission due. You'll have your workflow in there to be able to make sure you edit, review and approve, the data and documents, and then you'll be able to create that structured data where available, and then send it off to the registry.
Hmm. And so when it comes to, the folks in quality usually talk about audit readiness, meaning specifically your trial should be auditable and pass an audit at any time
Yep.
throughout the study. What are some common, would you say, misconceptions or challenges that teams typically face with EUCTR readiness?
Sure. I think they really underestimate the enormity of what needs to happen. And again, we're just talking about maybe one submission here. So the close integration between teams, and then also the timelines. So not only do you need to get it done in a certain period of time, but now that there's a concept of you have to keep certain information updated, or you could get health authority questions. And a lot of times you maybe only have 15 days to respond to that. So if you don't have a tightly aligned process, a centralized process, you're going to run into trouble there,
Hmm.
meeting those demands.
Hmm. Hmm. And how would you say you're meeting some of those growing expectations, like for transparency from patients, from regulators?
Yeah. So, disclosure and transparency isn't just a regulatory requirement. It's also, a trust issue as well with industry. So that industry is doing the right thing by patients. So the fact that we're able to easily help sponsors create these submissions in automated fashion in a centralized way, again, is going to allow them to have direct oversight. We have dashboards, exactly what's going out and when, what's coming up. So they'll have that confidence level that they're putting, accurate information out there, that, again, when that's searched on the registries in a public venue, researchers, patients, participants are going to have that confidence that everything is valid and up to date.
Mm-hmm. So we're talking about alignment, checks and controls, quality.
Exactly, and I think this really brings it all together. So when you have a platform like Veeva with a strong foundation that you can build an application like Veeva Disclosures on, we inherit all those great features that the platform has, that foundation, and then we can put those specific requirements to tackle the challenges of disclosure and transparency in an application that is really gonna streamline things and make you more efficient.
Mm-hmm.
So.
Mm-hmm. Is there anything else you'd like to add?
I would just say, again, there's so much more advantages of being able to manage disclosure on a unified platform. Again, moving away from those days where there were point solutions and integrations that are needed. So I really think that trend of being able to do things on one singular platform, have that one user experience, but have all your data and documents right there is really the trend in the wave of the future here for disclosure management.
Mm-hmm. Well, Matthew DeFranco, Senior Director of Disclosure Strategy at Veeva, thank you so much.
Thank you.
Matt.
Thanks for having me. Appreciate it.